Hello and welcome friends. Myself Dr. Ajay Officer at United Sigma Hospital Aurangabad. Diabetes has been growing at an alarming rate in India and the complications of diabetes are beyond our imagination. The only way to tackle this problem is to have more and more knowledge about this disorder. In a small endeavor to improve your knowledge, we have prepared some very good health videos which are included in this CD. So I request you to make use of those videos to enhance your knowledge about diabetes. Thank you.
Energy for the normal functioning of your body comes from the food we eat. Carbohydrates are a major component of food that provides energy. Proteins are required to build our body. During and immediately after a meal, the process of digestion breaks carbohydrates down into sugar molecules, of which glucose is one, and proteins into amino acids. Right after the meal, glucose and amino acids are absorbed directly into the bloodstream and blood glucose levels rise sharply. Insulin is a chemical that is secreted from the pancreas, which is a gland that lies behind your stomach in your tummy. The rise in blood glucose levels signals important cells in the pancreas called beta cells to secrete insulin, which pours into the bloodstream. Within 10 minutes after a meal, insulin rises to its peak level. Insulin then enables glucose and amino acids to enter cells in the body, particularly muscle and liver cells. Here, insulin and other hormones direct whether these nutrients will be burned for energy or stored for future use. It should be noted that the brain and nervous system require glucose round the clock. They cannot use any other substance for their needs. As blood glucose levels reach their lower peak, the pancreas reduces the production of insulin. About 2 to 4 hours after a meal, both blood glucose and insulin are at low levels. The blood glucose levels are then referred to as fasting blood glucose concentrations. When your body does not have enough insulin, sugar cannot get into your cells. As a result, you have high levels of sugar in your blood. This is called diabetes. When you have too much sugar in your blood, many problems may begin to occur. These problems can be life-threatening if they are not treated. However, proper treatment can control your blood sugar level. Let's take a look at the typical symptoms of diabetes. Increased urination, since excess amount excreted in urine glucose draws more water. Excessive thirst and the drinking of a lot of fluids. Increased appetite. Weight gain or weight loss. Blurred vision. Skin infections. Tiredness. Slowly healing sores. An abnormal prickly feeling, burning or itching of the skin, usually on the hands or feet. On testing the level of sugar in your blood, if your morning fasting blood sugar, that is before breakfast, is above 126 milligrams per deciliter, you may be diabetic. Since the glucose levels are high in blood and when they cross a particular level, they are then excreted even in the urine. At such times, one can detect the presence of high amount of sugar in the urine also. This test is also commonly used to monitor diabetes. When you have too much sugar in your blood, many problems may begin to occur. These problems can be life-threatening if they are not treated. Diabetes commonly affects three body structures: the nerves, eyes, and kidneys. Nerves are like fine wires that carry messages to and from your brain. They are required to feel various sensations of hot and cold, smooth and rough, etc. Nerve damage, also called diabetic neuropathy, most often affects the feet and legs, but it can also affect other parts of the body. Nerve damage makes it hard for your nerves to send messages to the brain and other parts of the body. It can mean you lose feeling in parts of your body or have a painful tingling feeling. If you have nerve damage, you may not be able to feel an injury like an ulcer on your foot. The ulcer can then become infected, and in serious cases, the foot may have to be amputated to prevent the infection from spreading all over your body. The retina is part of the eye that is sensitive to light and helps you see. Diabetes can damage and weaken the small blood vessels in the retina. This damage is called diabetic retinopathy. When the blood vessels are weak, they can leak fluid, which causes swelling in the eye. The swelling blurs your vision. If the retinopathy gets worse, your eye makes new blood vessels over the retina. But these blood vessels are fragile and break open easily, which causes bleeding into the eye. Scar tissues that follow bleeding may make the retina break away from the back of the eye and lead to blindness. Laser surgery can often be used to treat or slow down retinopathy, especially if it is found early. Kidneys are important excretory organs that are situated in the back side of your abdomen, close to your spine on either side. Diabetes can also damage the blood vessels in the kidney, called diabetic nephropathy, so it can't filter out the body's waste. This can lead to accumulation of toxic substance which comes in the way of normal functioning of the body. Many a times, high blood pressure is commonly associated with nephropathy. This can further damage the kidney. If the kidneys are damaged, they lose their efficiency, and this leads to filtering out of proteins from the blood into the urine, which are otherwise not excreted. Protein in the urine is usually the first sign of nephropathy. Excretion of proteins can further aggravate nephropathy. If your doctor notices early signs of this, he or she can put you on a medicine that helps protect the kidney from damage. If you have diabetes and high blood pressure, it is important to keep them both under control as much as possible for kidney transplants. Some people who have nephropathy need dialysis.
Welcome back, friends. I am sure after watching these videos, you must have gained your knowledge to a great extent. But at the same time, these videos must have instilled so many questions in your mind about diabetes. So we are there to answer all your queries. We request you to please contact us for any solution to any query. Thank you and best of luck.
Diabetes is a growing health problem in the world today. Changed lifestyle marked by a lack of exercise and sedentary habits has got a tremendous influence on this upcoming danger. This presentation is meant to acquaint common people with diabetes, its causes and effects which influence the overall life. Diabetes mellitus is a disease causing high blood sugar level due to the relative or total deficiency of insulin. Insulin is a hormone secreted by beta cells in the pancreas. It helps tissues to move sugar from bloodstream into the cells in order to utilize it for the metabolism. In absence of insulin, sugar remains in the blood, causing its levels to increase. Tissues also cannot use sugar as an energy source, in spite of its availability in blood. Higher than existing amount of insulin are required to achieve this. Initially, pancreas tries to make up for the situation by producing extra insulin, but eventually, insulin production falls as pancreas gets tired of producing extra insulin. Fatigue sets in. Consequently, blood sugar levels rise and people begin to experience symptoms of diabetes. The symptoms of diabetes are more or less similar. However, depending on the causes of diabetes, it is classified as type 1, type 2, and gestational diabetes. In type 1 diabetes, some or all insulin-producing beta cells of pancreas are destroyed by the body's own immune system, leaving the patient with little or no naturally produced insulin. It is seen in only about 5 to 10% of population and typically diagnosed during adolescence, before 35 years of age. This type of diabetes is alarmingly on the rise world over, while in type 2 diabetes, the ability of pancreas to produce sufficient insulin to manage sugar level in blood is reduced. It affects 90 to 95% of population and is diagnosed mostly in people older than 40 years. Gestational diabetes is found in pregnancy. This form usually disappears after delivery. Uncontrolled diabetes in pregnancy increases the chances of having a big baby and birth defects. We can see that diabetes afflicts a wide range of age groups. More the reason why all of us should be well versed with it. After all, forewarned is to be forearmed. After knowing about types of diabetes, let us see how it manifests in people. Most people with diabetes, including children and adolescents, have mild and unnoticeable or no symptoms at all. That makes it more dangerous, isn't it? A blood sugar level of more than 150 to 200 milligrams per deciliter usually is enough to cause symptoms. Frequent urination or polyuria, increased thirst or polydipsia, and increased hunger or polyphagia is common symptoms of diabetes. Vulnerable or compromised immunity makes one feel weak and frequently fatigued. Poor wound healing or generalized itching could be presenting features. Though dangerous, diabetes does warn us through many symptoms. Extremely high blood sugar levels can lead to a life-threatening form of dehydration that can complicate the diabetes. Other symptoms include obesity, increased insulin levels, high blood pressure, elevated triglycerides, and low HDL cholesterol. It all causes increased incidence of atherosclerosis and affects heart, brain, and arteries supplying the legs. Uncontrolled diabetes leads to complications involving eyes, nerves, kidneys. Foot infections and ulcers may develop due to peripheral disease of the blood vessels. The main test used to diagnose diabetes is a blood glucose test. It is done twice after overnight fasting and after 2 hours of lunch. These blood glucose levels give status of glucose tolerance in the body. In other words, it tells how efficiently glucose is utilized by the body. Fasting glucose levels tells us about general blood glucose levels over 8 to 10 hours, while post-lunch glucose levels shows how well glucose is digested within 2 hours of intake of food. Above normal levels indicate poor usage or tolerance. Medications are expected to improve this intolerance. Such kinds of blood glucose tests are used to diagnose or monitor diabetic treatment. For potential diabetics or non-diabetics with higher risk of developing diabetes, a glucose tolerance test is performed. In this test, 5 sequential blood samples at 30 minutes interval are tested for blood glucose. In this case, first sample would be after fasting and second sample would be 30 minutes after having 75 to 100 grams of glucose. Subsequent samples are collected after every 30 minutes till 2 hours elapse. The results are plotted on graph to ascertain the status of glucose control. Urine tests for sugar are not as accurate as blood tests and are not recommended. Another blood test that may be conducted is called hemoglobin A1C. It measures average blood glucose over preceding 2 months. It is useful to know the baseline level of hemoglobin A1C, as successive treatment can be monitored subsequently by comparison. Investigations like fundoscopy, creatinine, lipid profile and urine for microalbumin are done to find out the evidence of complications of diabetes affecting eye, kidney and nerves. Physical examination is done to find decreased sensation and reflexes in the legs, poor pulses in the feet, blisters, ulcers or infections of feet and abnormal heart rhythm. Diabetes is a lifelong ailment and requires regular monitoring and dietary control. However, it can be contained and managed, as proved by millions of people. Know your risk. There are many risk factors and caution should be exercised if you're more than 45 years of age, overweight, having diabetic parent or siblings, and have a sedentary lifestyle. It is possible to lower the risks of suffering. Here are some of the ways. Let's get started. Exercise regularly. Invest in yourself. Try to remain healthy by increasing the amount of physical activity. For example, climb the stairs rather than taking the elevator. Walk to the store instead of driving, and make an effort to get out of the chair often. In addition, work up to at least 30 minutes of dedicated exercise every day. Control your weight. Calculate your body mass index. If BMI is less than 25, very good. Maintain it. If it is between 25 to 34, watch out. Reduce your calorie intake and increase your physical activity. Make better food choices. If it is more than 35, hey, it's a wake-up call. Start a more structured weight loss program. Talk to your doctor about getting tested. Better still, educate yourself and your family about diabetes. Learn to use a glucometer. Glucometer is a handy and easy device to measure blood sugar anytime and anywhere. It uses a reagent-coated strip. Single, uniform-sized blood drop obtained from a finger prick is put on this strip. Electrical signal generated by the enzyme in response to glucose is translated into numerical readings of blood glucose. Glucometer is used when frequent monitoring of blood glucose levels is required, especially in the case of uncontrolled diabetic on insulin. Adjustment in treatment plans can be made with these glucose readings. To ensure the accuracy of glucometer, it is advisable to undergo simultaneous blood sugar test in lab whenever possible. The difference of 10 to 15% in both readings is permissible. Glucometer helps you to keep tabs on diabetes, saving future trouble. You must know that over a period of time, diabetes can cause many health problems. Let us know about them. It affects three main organs, namely eyes, kidneys and nerves. Large and small arteries of all these organs are affected. This leads to a variety of problems like heart attack, stroke, kidney failure, blindness, peripheral neuropathy, impotence and Bell's palsy. Diabetes causes metabolic syndrome or syndrome X due to poorly controlled blood sugar. The repercussions are manifold and far-reaching. Cholesterol problems increase along with insulin resistance. Conditions like infections, severe illness, obesity, and thyroid disease can worsen diabetes by interfering with insulin response and glucose control. Medications like corticosteroids, thiazide diuretics, beta agonists elevate blood sugar by their mechanism of action. Very high level of blood glucose, above 400 milligrams per deciliter, very low sugar levels with or without symptoms, high grade of fever, symptoms of heart attack or stroke are considered as danger signals of diabetes. Medical help must be obtained in such an event. Diet, exercise, medications, careful blood sugar control helps you to live a longer and healthier life. More prevention strategies are available for type 2 diabetes than type 1. Let us learn about it. Almost all people get benefited from low-calorie diet. So go easy on the fast foods. Follow a nutritionally balanced diet in consultation with a registered dietitian. Your diet should contain 60 to 70% carbohydrates and monosaturated fats, 15 to 20% proteins, less than 7 to 10% of saturated fats. Eat consistent portions of food at regular intervals. Avoid smoking and alcohol. Take a daily multivitamin pill. Thus, you should limit your overall calorie count. Regularity is the key. Moderate physical activity for 30 minutes would help to reduce blood sugar almost by 10 to 20%. Always drink plenty of fluids before and after exercise. Exercise keeps blood vessels healthy, promotes glucose usage by muscles and keeps body weight down. If you are on insulin or a diabetic with complications, exercise suggestions should be taken from a physician. High-impact sport exercise, straining or repetitive weight-bearing exercises should be avoided. So, be careful. Type 2 diabetes in most people can be controlled with oral medications. Medicines from different groups work well in combinations. Diabetes can be easily managed. It is not as dangerous as it seems. Thus, with holistic measures comprising exercise, diet and medication, it can be very well dealt with and one can lead a normal and healthy life. So, what are you waiting for? Let us begin our fight against diabetes.